The unknown toxicity of medicine. Thank you, Dr. Schultz. I took a class from him and he handed out some handouts. And this is from a woman that was a doctor going to school. She became a doctor and decided to not practice medical, the MD side. She went the natural side because she realized from her own illness when she got in trouble that she got more help on the natural side. So this is part 2. Go to part 1. The unknown toxicity of medicine. The cold, hard reality about cancer chemotherapy. Cancer chemotherapy, unfortunately, is not specific in its action. It not only kills cancer cells, but normal cells as well. Researchers recognize that cancer cells grow and divide faster than any other cell in your body. Their aim in chemotherapy is to kill these cancer cells by using cytotoxic cell. Cyto equals cell, so this means it kills cells, materials. Toxic materials will kill the fastest growing cells first. However, there are normal cells in your body which grow almost as quickly, and they too will be killed by the toxic materials. The cells most susceptible to the effects of chemotherapy are the ones which divide and grow the most rapidly, which are the cells lining the mucous membranes, the cells lining the digestive system, the hair follicles, and the reproductive cells of the testes and the ovaries. Every cell in your body will be affected by the chemotherapy to a certain extent because these drugs are poisonous on purpose to kill the cancer cells. If the chemotherapy succeeds in killing the cancer cells, what price do the rest of the cells in your body pay? Will you die later from the toxic effects of these poisons? Is it not uncommon for these chemotherapy drugs, because of their toxicity, to cause leukemia or lymphoma a few years later on in your life? Then you will have to go through all this a second time, which will be much more difficult on you. In addition, you probably will not survive because you've been poisoned so severely. In general, most cancer chemotherapies has these similar side effects. Number 1, bone marrow depression. Bone marrow is found on the inside of the bones, and its job is to make blood. This process is slowed down, if not stopped, by chemotherapy. Clinical manifestations including the following: anemia, lower red blood cell count, leading to fatigue, dizziness, paleness, and shortness of breath when exerting oneself. Because the red blood cells carry oxygen to all the cells in your body, you will be getting less oxygen to each cell. Since cancer cells thrive in an environment where there is little or no oxygen, you will be causing your cancer to thrive and multiply more by becoming anemic. Leukopenia, lowered white blood cell count leading to infection. White blood cells are what make up your immune system, just what happen to be what your body uses to kill cancer cells. So depressing your immune system by taking drugs such as this will make it more difficult, if not impossible, for your own body to kill the cancer cells in your body. Thrombocytopenia, lowered platelet and count leading to bleeding. Lower platelet count leading to bleeding. Platelets are what cause your body to clot. If you have less platelets, you will not be able to clot your blood properly. Thus, you will bleed after minor trauma, just like a hemophiliac does. Depending on how low your platelet count goes, you could bleed into your lungs, intestines, brain, or peritoneum, all of which can be life-threatening. Number 2, digestive system disturbances. Diarrhea, vomiting, nausea, ulceration anywhere from your mouth to your anus can be extremely painful. Number 3, damage to your hair follicles. Alopecia, baldness. 4, damage to reproductive organs, sterility, hypogonadism. Number 5, carcinogenic, causes cancer. Yes, you read that right, by damaging your DNA. Leukemia, cancer of the blood. Lymphoma, cancer of the lymph nodes. Eventually, the side effects will become so severe that treatment will have to be stopped or the patient will die. For many of these drugs, the cancer cells will become resistant to the toxic effects through many different mechanisms. This effect is minimized by giving several drugs at once. This is why chemotherapy usually involves several drugs given simultaneously, called a regime, i.e.g. the MOPP regimen includes the drugs methylchlomine, acovurian, viasturian, proscobarazin, and prednisone. Now you are allowing yourself to be poisoned by many types of toxic material all at once. Any resistance can still develop not only to a single drug, but also to multiple drugs. Cytotoxic chemotherapy kills cancer cells by the way of certain mechanisms called first-order kinetics. All this means is that drugs does not kill a constant number of cells, but a constant proportion of cells. So, for example, a certain drug will kill half of all the cancer cells and then half of what is left, and then half of that, and so on. So you can see not every cancer cell necessarily is going to be killed. This is important because chemotherapy is not going to kill every cancer cell in your body. Your body will have to kill the cancer cells that are left over after the chemotherapy is finished. Now, how can you possibly fight even a few cancer cells when your immune system has been destroyed? You're anemic and you're not getting any healing oxygen to the cancer cells to kill them. You've gotten an infection because your immune system is depressed, and this is yet another stress on your body. And you're bleeding because you have hardly any platelets left from the toxic effects of the chemotherapy. Doesn't make much sense, does it? This is usually why when chemotherapy is stopped, the cancer grows again and gets out of control. We have now created a vicious cycle where doctors are trying to kill the cancer cells and you're not able to fight the rest. So the doctors have to give you chemotherapy again, and then you can't fight the rest of the cancer cells. And then they give you chemotherapy again, and so on, and so on. This cycle usually involves you ending up in the hospital, taking even more toxic drugs in a ridiculous attempt by your doctors to heal your chemical poisoning by putting more toxic chemicals on top of it. Okay, so that's part 2. We're going to go ahead and go to part 3 of the unknown toxicity of medicine in the next video. So it'll be the last one, and I hope this is helping you. And love life, and life will love you back. You can do that healthy.